One thing that I really want to talk about, and this is probably one of the biggest gray areas and areas of confusion with the current guidelines, is a medical device versus a standard penetration test. Standard penetration tests are looking for different goals compared to a medical device test. And so we have to do a little bit of different techniques to meet these goals. So medical devices are tested using very similar techniques as other systems, but we're pursuing different goals. Now, what I mean by that is there are only so many ways to hack into a Bluetooth interface. There are only so many ways to hack into a web application. So to make sure that we're staying with that cutting edge of hacking techniques, we're focused on just industry best standards for hacking in general. We're not trying to do specific hacks targeted towards a medical device. We're doing specific hacks targeted to the device itself. Doesn't matter if it's a robotic device, an automotive device. The Bluetooth interface is going to be compromised in similar ways regardless. Now, having said that, we're trying to pursue a different outcome if we're looking at a medical device. A standard penetration test is focused on the CIA Triad. That stands for confidentiality, or keeping sensitive information a secret; integrity, ensuring that nothing has been tampered with or modified without permission; and availability, ensuring that we have reliable uptime for a device or a service. While these are still very important metrics to go by and very important things to target during a medical device penetration test, there are a couple more things we have to consider, namely the potential for patient harm and the potential for protected health information loss. That's usually going to be our main focus when we're performing a medical device test. Can we hurt someone? Can we disclose about as well, in addition to many other regulatory bodies when we're focusing on this penetration test? So while the other metrics, the CIA Triad, will still apply, there's a broader scope of what we have to cover and a little bit of a shifted focus, which is very important to keep in mind during this penetration test. That's why it's very important to go through a firm that is experienced in medical device penetration testing as opposed to a standard penetration testing firm